Good day. This is Maritolin A. Dalasdas, and now we are discussing what is Lieshmania mexicana. Lieshmania mexicana is a borne vector disease that is transmitted by sandflies and caused by obligate intracellular protozoa of a genus Lieshmania. Human infection is caused by about 21 to 30 species that infect mammals. They also occur in reservoir hosts such as dogs, cats, and rodents. Lieshmania can be divided into Old and New World species, the former being responsible of continuous and visceral leishmaniasis, and the latter responsible for mucocutaneous infection. Lieshmania mexicana is primarily found in the New World, particularly in Mexico and Central America. It's one of the causative agents of continuous leishmaniasis, a disease transmitted to sandflies. Its distribution within this region may vary, but it's generally associated with tropical and subtropical area, where the sandflies vector thrive. Lieshmania mexicana, a parasitic protozoan, primarily inhabits part of Central and South America, including Mexico, where it causes continuous leishmaniasis, a skin infection transmitted by sandflies. Exhibit a molliformic life cycle with a mastigote form residing intracellular within mammalian host and promastigote form thriving extracellular in the gut of sandfly vectors. The life cycle of Lieshmania mexicana involves two main stages. Promastigote stage. In the sandfly vector, promastigotes reside and multiply in the midgut. During a blood meal, infected sandflies inject promastigotes into a mammalian host. A mastigote stage. Inside the mammalian host cell, promastigotes transform into a mastigotes, which multiply within macrophages and other cells causing infection. When a sandfly feeds on an infected mammal, it ingests a mastigotes, completing the cycle. Lieshmania mexicana pathogenesis involved the injection of promastigotes by sandflies into the skin, where they transform the mastigotes, multiply within the macrophages, causes cell rupture, and result in characteristic skin lesion. Diagnosis of Lieshmania mexicana infection typically involve a combination of clinical evaluation, microscopic examination of tissue sample such as skin lesion, culture of the parasite, and the various molecular techniques like polymerase chain reaction or PCR to detect the presence of Lieshmania DNA. Additionally, serological tests such as enzyme-linked immunosorbent assay or immunofluorescence assay may be used to detect antibodies against the parasite in the blood. Immunity of Lieshmania mexicana involves a complex interplay to innate and adaptive immune response influenced by factors such as cytokine balance, which can lead to either control of the infection or susceptibility to chronic or disseminated disease. Treatment of Lieshmania infection often involve antimalarial drugs such as sodium stibogluconate or betamethine, although the choice of treatment may vary depending on factors like the severity of the disease and the patient's overall health. Prevention and control of Lieshmania mexicana infection primarily involve vector control measures targeting such as insecticide spraying and the use of bed nets or protective clothing to reduce human vector contact.